20 years ago when I started my career as a firefighter, if you would have said we'd be wearing ballistic gear and responding to these types of incidents, I would have never believed it.
911, what is the address of your emergency? Confirm that address for me, please. Calm down, calm down. 17557 Corporate Boulevard. Somebody shooting a gun?
It's very uncomfortable. It's uncomfortable for the planners, for the responders, because we don't want to respond to these. I mean, our goal is to never respond to these, but we owe it to the community to bring our A game and to be as prepared to respond to these as we possibly can. But yes, it's a very difficult subject matter to even talk about, much less train on. This is unique in the fact that it's a truly collaborative effort. This is South Metro's hosting the training, but we've been working with 12 different law enforcement agencies inside our borders to make sure that this training is designed for everybody that's going to respond to these incidents, including our dispatchers. And it's based on a policy that all of those agencies have agreed upon.
Well, this type of training started in the approximately 2003, 2004, based on work that was even done a decade before that by a person named Bruce Siddle, where he was able to show the four detrimental parts of stress: tunnel vision, loss of hearing, amnesia, and fine motor skill loss. That's a bad thing for anybody that's a first responder, especially a first responder who is not in their normal habitat. It's truly a matter of habituation, getting used to an event. The technical skills are taught first, and then the event structure is taught after that.
People are dying! Help us! Please
It is safe to say we are very much so in an unusual situation. Situations that now are considerably larger and more difficult than previous situations of their type, unless you were actually at war previously. Nobody is in a comfort zone when they're in a war or in a difficult situation. But those that know that they are trained for that event and understand how to care for the various processes that happen in that event will clearly do better. The military started to develop what's called stress inoculation training, or training associated with realistic events. Strategic Operations is a movie studio that's a portion of Stu Siegel Productions. Stu Siegel Productions was at one point the largest television movie studio in America, and they pretty much starting about 2001 after the attacks of 9/11 and in 2002 and 2003 started to convert their movie studio techniques to identifying ways to help the U.S. military. This became very realistic in the way they involved making the explosions, having the actual logistic events and materials, the smell, the sights, everything that has to do with reality became reality, but without consequences of hurting either the soldier or the patient. So we've simply adapted that with a partnership approximately 7 years ago with Rocky Vista University School of Medicine and Strategic Operations. We helped both develop military training and first responder training that we are very proud of, that has beyond any question improved first responder work here at South Metro?
As director of the Simulation Center, I have a lot of different aspects at Rocky Vista in simulation in various aspects of surgery, medical, and teaching our students how to perform tasks and learn some of the things they need for medical school in a simulated environment instead of with real patients. As the technology has advanced in simulation, they get a lot better idea of what really happens on a real person as opposed to just an old plastic mannequin. We still use some of the older models for certain task training, but now we've developed the technology so that it's much more realistic. Once you've done that on a softer model that has a battery pump that bleeds and is really hyper realistic in what we call a cut suit, it makes a much closer simulation to what reality is once they actually do have a real patient. Well, a cut suit is considered a partial task trainer, so it is human worn and it is hyper realistic, so it's so high fidelity that it really seems real. Most everyone that operates on one says this is really like the real thing. So we can teach surgeons, we can teach already practicing physicians, residents, medical students in a very state-of-the-art model. I mean, back in the olden days, you really did kind of observe your senior resident or your whoever was a year ahead of you doing a procedure, and then you would be kind of proctored through it a little bit, and then you're on your own. But you were actually doing it on a real person. And I think for the most part that went pretty well. But in this day and age, I think it's just much safer that since we do have the technology to try it on a fake patient first before you go into a real patient. And they have blood packs so that when you make an incision, there is actual blood. When you open an amniotic sac, there's amniotic fluid. So there's a lot of interactive, it's kind of a mess, but that's what makes it realistic. So many of the physicians as well as the assistants and nurses all say, wow, this is really real. This is like the real thing. We're fortunate that Rocky Vista is local and in Colorado, in Parker, and it actually is one of the national leaders in simulation. South Metro has just been, again, a leader in the simulation and working on these mass casualty and active shooter drills. Just very, very good training for the first responders. And we have a really good working relationship, a collaboration with them, because there's a lot of people and a lot of moving parts to the mass casualty scenario. And South Metro has done a really nice job, and we work, Rocky Vista and South Metro have worked together for many years.
I became a paramedic 36 years ago, and the extent of the moulage was red lipstick and some dirt. Literally, it has come so far that it's tough to imagine what that's like for people to actually, it's a simulation, but yet there's blood, there's bowel contents, there's organs hanging out, you're doing procedures on live people. And there's no substitute other than the actual events, and you may go, hopefully, your entire career and never have anything like this. But if you do, all the planning in the world doesn't survive first contact, and this kind of training gives them pattern recognition, gives them things to draw on, and in as realistic as scenarios we can provide. I think it is a strange responsibility in our land to be at the state that we are. It's not going to go away. The reality is that patients need to see, potential patients need to see what happens and how things go on, and from the outside it looks a lot like controlled chaos. And so when they see how that chaos is brought into order, it's still like watching sausage getting made. It is not a pretty picture, and it looks like a disorganized event, but in reality that's as close to a smooth operation as you will ever see. And it's a testament to doing it over and over again. It's a testament to training, because you wouldn't expect us to just stand ready and apply the skills we have to an event like this without ever having exercised it. That doesn't work. It's shown throughout history over and over again. It doesn't work. So this is as close as we can make it to providing them with training to be able to manage something like that. And hopefully we spend a lot of effort and a lot of money, and we all retire without ever having to use it. That we all hope that, but we're not foolish enough to imagine that the possibility doesn't exist. I do think it's really important that people understand that it's when they start to look close at what's going on here, the intricacy of everything that's involved. Each individual person that's been made up as their own microcosm of a call that typically takes, 10 responders to deal with on a normal call. And so to watch all those people here, these highly trained people, handle those with more than one patient to each provider, and imagine the gravity of what they're trying to get done, that's an impressive feat, and they do a great job. It's something that we want to share with everyone. All the secrets and the tools and the tips that we learn through this environment, we share. So even departments that don't have the means to be able to do something like this, we try to give them the tools and the knowledge to know where to go, who to partner with, how they can produce things like this, and what we learned. This isn't a business where we're trying to get market share by any means. What we really want is for everybody to be highly trained and very efficient. What you can expect if you do call 911 is that the people that show up from this department are highly trained. They're motivated to treat people like family. They're rewarded for that. They enjoy it. And it becomes a lot more than a cliche. So I think we've given them the best that we can, and we're going to continue to use events like this to push that envelope even farther.
Sir, so I'm going to have to put this tourniquet on your leg to stop the bleeding. Okay, it's going to get really tight, and it's going to hurt, but it's going to stop the bleeding. Okay.
Drew, you got one rig? One, sorry. One rig. Okay.
It's okay. The ambulance is on its way. I need you to work on just nice, easy, slow breaths.